Good morning, Chicago. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. Today, believe it or not, is Thursday, July 1st, and we are here, as always, to take your COVID questions live. You can put your questions directly into the box below. You can also use the hashtag AskDrArwady on either Facebook or Twitter, and you can go ahead and start putting those in. We had a lot of questions come in related to Delta variants, wanting to see some data. So I actually did bring just a few little excerpts from some of the studies of what we're reading every week, just to dive into that. So we will do that in just a second. But first, as always, let's take a look at where we are as a city. And the news continues to be good right now related to COVID. So you want to go to chi.gov/COVID-. That's our COVID dashboard. That's got all the information specifically for Chicago by zip code, by time, cumulative, most recent week, most day. And we continue to update this Monday through Friday every single day. So if we take a look at the homepage here, you see that we are averaging 35 cases per day. I love that. You see one case per 100,000 per day here in Chicago. Really, we're doing great. You can see that has continued to drop. We're down 13% from a week ago. We're also averaging just between 3 and 4 hospitalizations a day, down from 5 a week ago. And both of these are just hugely down from where we were. Cases, right now we're talking 30 a day. I mean, we had over 3,000 a day at the peak. And it's amazing to see this progress. 3 hospitalizations a day, that's many fewer people than get hospitalized for a lot of other conditions, really different than in the surges where COVID was really driving our hospitals getting full. We're averaging between 1 and 2 deaths a day, a little closer to 1 at this point. That also, all of these are the lowest that we've seen since the beginning of the pandemic. We're still doing a little over 5,000 vaccines a day. Progress, and we are, as you know, working hard and knocking on doors and doing at-home vaccines. We also continue to really be working with churches, working with places where seniors gather, thinking about where youths are. Given that it's July, I know it's hard to believe, but it's not that long from when we start thinking about back to school, particularly if you want to make sure that your adolescents are fully vaccinated before school. Right now, the only vaccine that's available is the Pfizer vaccine for children under for teenagers. And so to get 2 doses of that, plus have the 2 weeks, you do want to be getting on that vaccine now to help protect those adolescents when they're back in school. We're doing a lot of testing, about 8,800 tests every day, and then our positivity remains at 0.5%. Very, very pleased with this. And behind the scenes, we can come off the dashboard. Behind the scenes, we do look at this, what is publicly facing here, but also the epidemiologists at CDPH. We track a lot of different metrics, not just for where they are right now, but what are the changes over time. We're looking behind the scenes, and those of you who have explored the other data on our website, our reopening metrics, know that we are also following things like hospitalizations and ICU and emergency department visits, not just with the numbers, but with the rate of change. So I do want to pull up and show just a little bit of some data here. First, to get a sense of where we are, because we continued to get some questions about this. And let me just get into slideshow view here. So this is the same COVID community risk matrix that we've been using all along here. You can see that these 4 main metrics that we talk about, cases diagnosed per day, test positivity, hospital beds that are non-ICU with COVID patients, and then ICU beds that are COVID patients, all remain in the lower risk, or in fact, now both our COVID test positivity and our hospital beds are in really low risk, controlled transmission, the lowest level. And you can see that our cases are not that far from being in what we would consider a controlled transmission state here. And ICU also really trending in the right direction. And we got some additional questions about masks and variants, and I'm sure there will be some more of those, so we'll address them. But I want people to kind of keep this matrix in mind, because we think about this as we are making decisions for Chicago. We start to see things head the wrong direction, either in terms of the numbers or the rate of change. That would be when we might think about changes. But the good news is with vaccine here, I'm not expecting the major surges like we saw in 1 or 2 because they remain protective against all known variants. We also had a lot of questions come in about all the ways in which variants can be concerning. And I wanted to just, if folks were not on when we talked about this a week or 2 ago, some of the ways that we have seen the COVID virus change or mutate or evolve are all things that help it survive, help it reproduce. And so the one that has gotten the most attention is increased transmissibility. That means it's more infectious, it's more contagious. And that's the one that when what's now called the alpha variant emerged, it very quickly outcompeted the other variants because it was more infectious, it was more easily spread. And that sort of gave it the benefit, if you will, against the host. And that is the primary concern with this Delta variant as well, that it is more transmissible. You don't need as much exposure to it to be potentially infected. But again, if you're vaccinated, the protection level remains good. But then some of the other ones, this question of increased disease severity, is it more likely to hospitalize people or more likely to have people die? And on Delta, this is still an open question. For people who are not vaccinated, there has been some data that, like in Scotland, they did see a little bit of increase in terms of risk of hospitalizations, but then in some of the other countries, they really haven't. Here in Chicago, we've not seen, at this point, increased risk of hospitalization, even where people have had the Delta variant or the other variants, but that's something we're watching. Then evading vaccine-induced immunity. That means, does the vaccine continue to protect against the variants? And that's the one, really, I'm the most worried about. Not right now, but in terms of what could evolve in the future. The news is good, and we got questions about this too. So for all 3 of the vaccines we're using in the US, the Pfizer, the Moderna, and the J&J, they remain highly protective, especially against the severe outcomes for all known variants of concern, including Delta. So some of you asked about Johnson & Johnson. Yes, those studies have been done, and J&J did release data that the level of protection is good. You do see a little decrease, right? It's like with Pfizer. I showed the study the other day that went from, I think, 93% after 2 doses to 88% protection. So you do lose a little bit. But broadly, it's good. And if everybody were vaccinated, I would have 0 concerns about variant. I actually have 0 concerns about COVID here in Chicago. But we know everyone isn't. And then evading infection-induced immunity means where people have some level of protection because they've previously been exposed to COVID. So, this week, this month, there's been a lot of conversation about Delta, but last month we were talking a lot about this P1 variant, which was the one originally from Brazil, and originally detected in Brazil. And one of the reasons that I was concerned about that one is that they were seeing in Brazil a lot of people who had previously had COVID, been infected, again, get infected a second time. And that's worrisome because especially if you don't have good vaccine available, it's suggesting that people who have had natural infection wouldn't have as strong of protection. And P1 was actually, we had more cases of P1 detected here in Illinois and in Chicago than anywhere else in the country, where we were looking back a month or 2 ago. And so we were talking to CDC, we were watching this really closely. We didn't see a surge. We again didn't see major problems with hospitalization or bad outcomes. But the Delta conversation is not the first. It's not going to be the last of variant conversations. And again, at this point, we've not seen at a population level them have a big impact yet. It's possible in the future, and especially if we were to see a variant emerge that we don't have good protection against. Evading therapeutics means do all the drugs work? So that P1 variant, for example, flu, there is an antibody treatment that you sometimes give people to help treat COVID, and there's a few different versions of it. One of the antibody treatments doesn't work very well if somebody has the P1 variant, so that's concerning, and therefore we had to let folks know that they should use this particular kind of treatment instead of the one that doesn't work very well against P1. And then finally, evading diagnostics. This is not one we've seen too much yet, but it's a possibility that you might not be able to test for it appropriately, right? And each of these has some level that can make a variant first of interest, secondly of concern, or finally of high consequence. We don't have any vaccines at this point that have been considered high consequence. That would be if really the vaccine isn't protective, or we would need to revert to changes in our recommendations. And I'm just going to show quickly 3 excerpts from studies, again, to try to get at a lot of the questions that were coming in. This is a study that was published in The Lancet. All of these are published literally in like the last week. This one's or the last couple of weeks. They're all from June. And Sheik is the primary author. And the reason I wanted to highlight this is it shows between May 1st and May 27th, how quickly the Delta variant overtook the Alpha variant in Scotland. So what this is showing you, on the left side of the graph, on May 1st, in green is the Alpha variant, B117. And you can see almost all of the COVID that was being detected in Scotland was the Alpha variant. There was a teeny bit of Delta in red, and then just a little bit of other. And that would be like the original variant, right? The Alpha variant is now the dominant in Scotland, in the US, in Chicago. And you can see as this month went on, we didn't see a lot of changes in other, but the Delta variant really very quickly outcompeted the Alpha variant. And so by the end of the month, they were seeing about 60%, right? The majority of the COVID being detected in Scotland was this Delta variant. But the good news is that the vaccines did remain effective in terms of preventing hospitalization from Delta. So there's been a lot of attention, and I absolutely expect that the Delta variant will outcompete what we have seen here, over the next couple of months. But that in and of itself is not necessarily a cause for alarm. And as long as people are vaccinated and we're not seeing major surges in infection, the combination of those two things, it raises concern, of course, but it is not, it's not something that has, the replacement of Delta itself is not the thing that is the primary concern. The question is the outcomes that we see from that. And so in the same way, the Alpha variant is now the most common variant in the US, the Delta one probably will be. And probably in the future there will be another one. And the real question for me is, do we see variants emerge where the vaccine is no longer as effective? And that would be when we would probably need to be talking about boosters. Okay, second study. This one is from Germany. Hertzberg is the primary author. And this was really related to, we've been getting a lot of questions about, how protected am I with 1 dose and 2 dose and natural infection. And this was a nice study of healthcare workers in Germany. And they have basically followed hospital employees who had gotten vaccine or who had gotten infected with COVID. And just to sort of talk you through this, we're not going to go into the details. You can look up the paper if you want. But what this is showing is on the left here, this really low blue bar, the higher the blue bar, the more protected you are against COVID. You have more antibodies and dramatically more antibodies in the scale that we're using. So you can see if somebody's had no infection and no vaccination, they have no protection, right, against COVID. But then if they've had natural infection, meaning they've had COVID and they've recovered, but they haven't been vaccinated, they definitely get some protection against COVID. And that is good news. And we're still learning about how long lasting that is. There's lots of different kinds of immunity that can be elicited. This is about antibodies in particular, but you definitely get some protection, and that is good with natural infection. But then if they get, if they've had one dose, and these are just two different vaccines, AstraZeneca and Pfizer, that part's less important. You can look at the details. You know, you see that with one dose of vaccine, you're getting a protection similar to, at least in this study, similar to what you were potentially getting with a post-natural infection. And then really with the two doses of, this is the Pfizer vaccine, was when we saw the really more significant protection, that high antibody that is thought to be sort of more long-lasting. And all of this is just showing this is very statistically significant. And so there continue to be a lot of different studies like this, again, highlighting that need for the second dose, like we talked about, particularly against Delta, and then that there is some protection from the natural infection, but it's not thought to be probably enough in terms of long-lasting protection. And then the last one, this was a study by Wang, again, June 14. This one's from Nature. That is arguably the top science journal in the world. And so anything that gets published here gets a lot of attention. And this was a study where they were following up people who had gotten infected against COVID over time. How good were their antibodies compared to if they had been vaccinated? And the nice thing was that this was looking at a few different types of immune response. And I'm not going to get into all the details. You can read the paper if you want to see the science yourself. But they were able to see antibodies and memory B cells, and specifically look at what's called the neutralizing activity. That's that NT50 thing. It just means, could you neutralize? Could you, like we think about neutralizing like in a Superman movie. You neutralize the enemy. The idea is, can you neutralize the virus here? And so what we see, let me kind of talk you through this, is that on the left graph here, it says Wuhan Hu 1. That's like the OG, the original version of COVID. And then this study is looking at different variants that have emerged. There's that P1 that I was talking about, B117, that's the alpha. These are, and this is the kind of work that gets done. And what they saw here, if we talk through the original one, for example, was that this is about 1.3 months after infection, 6.2 months after infection, and 12 months after infection. You definitely continue to see some good level of protection. And so this is some good news, right? As we've been learning that you continue to have some level of protection after both natural infection and vaccination. But after vaccine here, this is higher, and on this graph it may not look that much higher, but if you remember what 10 to the third or 10 to the fourth or 10 to the fifth, that's how many zeros you're adding. And basically they're seeing here that when people had also gotten, these are people who had gotten infected with COVID and then they also got the vaccine, their protection jumped up to a point where it was, between about 20 to 70 times as good. And so this has been this work around saying where you get some protection from natural infection and having recovered, adding on a vaccine to that, a level of protection this high, and you see that we see the same pattern against all the variants, that there was some level of protection after natural infection, but then when you boosted that with vaccine, the level is dramatically higher and then thought to be more persistent. And so this is some of the conversation about where we'll be making recommendations potentially, down the line around boosters and following it. But I hope for some people, and I know this is a lot of science, and I'm not trying to get into too much of the details here, but the bottom line is that the vaccines continue to look good against all of the known existing variants, that there is certainly some protection that may last related to natural infection, and that then when you boost that with the vaccine, it is at a much higher, as much as 70 times higher, that level of protection without severe side effects. And that's why there's some of this theory that may be, good enough for life. But we'll see. That is not a determined thing yet. But we keep seeing more studies that are suggesting that combination is important. Okay, so that was a lot of science, but I hope it was helpful for some of you who were sending in all kinds of questions. And we'll turn now and see what kinds of things people have. Okay, Leisha Smith from Facebook. Only one death. Is COVID considered over? So we're averaging, like I said, about 1 death per day right now in Chicago. So that means, between 1 and 2. So we're averaging about 7 a week. What would that be? 30, 35 a month. So that is well controlled, right? And there's no such thing as kind of over when it comes to COVID. This is a little related. I see there's some questions in here about, is COVID ever going to be gone entirely? Are we going to eradicate it? I don't think it's likely that we are going to eradicate COVID unless there's some breakthrough in treatment, for example, or something that like a completely different approach. These vaccines are about as good as they get. If everybody got vaccinated, like in the world, yeah, we could eliminate COVID, but I don't think that is likely to happen. The real question for me is, can you get the population to a point where COVID-19 is no longer a threat in terms of severe illness or these disruptions to society? And so coronavirus itself, we have plenty of coronaviruses in the world. The common cold is some of them are caused by another strain of coronavirus. It's just been that COVID-19 has been so much more infectious and especially so much more dangerous in terms of hospitalizations and deaths. So we are in a place where COVID is better controlled than it ever has been in Chicago. And for people who are vaccinated, this is why the risk is really low and the news is good. You're being protected not just by your vaccine, but by the fact that there is not as much COVID circulating right now. The question for me is what's going to happen in the fall and in the winter. I think I've talked on here a little bit about, we always think about when you study epidemiology, when you study disease, right from the beginning, you learn about this triangle of the host, which means us, the pathogen, which means, in this case, the virus, and then the environment. And you think about the host, us, and how we can change, the pathogen, the virus, and how it can change, and the environment and how it can change. And as these three things change, it affects how aggressive the disease is, whether we're able to break that chain of transmission. And so, for example, for the host, the biggest way we change as the host is getting vaccinated. But also our behavior changes, right? And so the mask wearing that we did, especially before vaccine, and our distancing and being careful and hand washing, all of that stops, help stop the pathogen, the virus, from being as successful. So we, evolve in terms of the ability to better fight off the virus, both through behavior and especially through vaccine. The virus over here, though, the pathogen, is also evolving. That's the mutations. It's working to try to be more infectious. It's working to be able to evade the vaccine. It's working to survive. And both of these are impacted by the environment. And this is where I talked on Tuesday. I'm a little concerned that we're seeing a surging COVID in the Southern Hemisphere in their winter, because that is a pattern that we see for many other respiratory illnesses. And I am not particularly concerned about these next few weeks here in Chicago and in Illinois with where we are, even with the Delta here. I am more concerned about what may happen as the environment is changing, as we move into, cold and flu, and what we may come to think of as cold, flu, and COVID season. If you're vaccinated, I'm not worried about you, broadly speaking, but we still have a lot of people, communities, social networks that are not well vaccinated. And there is more potential for surge, in that setting. So, and there's other pieces, right? Humidity and where we have put structural changes in place, whether we can be outside or inside, right? It's a lot harder to just say, let's get together outside in the winter than it is in the summer. So all three of these will continue to interact. We're going to continue following it. And last summer was the best that we ever were with COVID before this summer, even when we didn't have vaccine. And I think a lot of that was also about environment, frankly. So I hope that helps put it in some context. But we're feeling good about where we are, but we are not yet taking letting up in terms of our level of surveillance and continuing to make sure we have strong plans in place in case we do see surges. And I don't think the surges, to be clear, unless we get a new variant and these high consequence variants where the vaccine really isn't working, that would be very worrisome to me. But in the absence of that, the really bad first and second surges were mostly because we didn't have a vaccine available. The host was not able to adapt, and we saw a lot of spread. I think that little, in April, that surge that we saw, it was not dramatic, but it was there, right? We definitely saw cases going up. We saw hospitalizations going up. We saw deaths going up. We didn't need to take a step back in terms of reopening, but we had to delay a little bit. Do you remember that? Some of the steps with reopening, we really wanted to make sure things were in good control. We never threatened the healthcare system in that setting. And right now, that's kind of what I think, where I look down the line and I think about what could happen with Delta or what could happen with a surge. While the vaccines remain protective, that surge in April was like all people almost that were not vaccinated. 90, and we share this a lot, but 98% of the people who have been who have died from COVID since the COVID vaccine, you could first be fully vaccinated in January. Here in Chicago, 98% of the people who have died, 97% of the people who have been hospitalized were not fully vaccinated against COVID. And as time has gone on, and you look at this nationally, it's like even stronger. More than 99% nationally of the people who are being hospitalized and who are dying of COVID in the month of May were people who were not vaccinated. And so, my worry is if we see a surge, it would very much concentrate in unvaccinated portions of Chicago. But I don't think, unless we see a new variant, we would be set up for the kind of major surge that threatens to overwhelm the health system, where we need to do the big major shutdowns. The hope is that we would be able to control it and really keep pushing vaccine. I'd, of course, rather avoid that and just try to get folks vaccinated now. But that's where I think ahead, and I'm talking a lot about this because there's a lot of questions about what's coming next and what do I think. That's sort of the way that I'm thinking about it. Some of that surge in April was probably due to the Alpha variant, and we may see some surge like that in Delta, but it'll be in folks who are unvaccinated based on everything we know now, and I don't think it's likely to overwhelm the health system. Jimmy Morgan on Facebook, why is there minimal information about those who have had COVID and their antibodies? I am lumped into the non-vaccinated, but I caught COVID in the natural environment. I really need help understanding this. Yeah, Jimmy, good question. So the study that I showed just now was actually looking at that. It was looking at people who had had COVID and checking their antibodies. And there are a lot of studies that are going on. And what we have seen is that people who had COVID naturally do have some protection against COVID. And we're learning about how long that can be. There's all different types of immunity. So there's antibodies, but there's also these B cells, and your body kind of learns to fight in different ways. And in the study that I just showed, but in a number of other studies that have been coming out, including when they've been looking at people's bone marrow, what they've seen is that, like, if you're unvaccinated but you've previously had COVID, you have some level of protection against reinfection from COVID, which is good. But if you pair that with a vaccine, your level of protection is much better, and especially where there have been variants like that P1 that might make it more likely that people are getting reinfected, the vaccine is probably more protective against that. So I hope that helps help you understand. We do see some protection, even at the population level for sure, from people who have had natural COVID and have recovered. And where there are people who decide not to get vaccinated and they get COVID, like if we have a surge, at the population level, they also contribute at some level to our, to how protected we are as a city. It's just that, like, if I had to choose between getting COVID and the potential risk and, what we've seen happen there versus having the protection from a vaccine, for me anyway, I would much rather have the safe and effective and predictable response. But even for people who have had COVID, and I have a lot of friends and colleagues in that situation, I've strongly advised them to get vaccine because the level of protection is better, including antibodies. So thanks for that question, and I hope that helped. All right, Daniel Lang via Twitter is asking, I'm scheduled to get my second dose of the Pfizer vaccine. Well, I need to get a COVID-19 booster shot in the future. Okay, Daniel, really glad you're getting your second dose of Pfizer. We've clearly seen you want to get both doses for either the Pfizer or the Moderna, where it is a two-dose vaccine. And I cannot answer whether you will ever need to go to the COVID-19 vaccine booster shot in the future. What I can say is right now, there is no recommendation for you or anybody else who is fully vaccinated, one shot of J&J or two shots of Pfizer or Moderna, to need a booster. And what a lot of the research about this has been is that all the data looks good in terms of as long as we have been studying these vaccines, the protection levels have remained good, even as variants have emerged. But we've only been able to study it for a year plus. And so first, there was a lot of hoopla saying the vaccines are good for 6 months. It wasn't that the vaccines are only good for 6 months. It was that they were safe and effective without long-term effects for at least 6 months because we'd been able to monitor the earliest people for 6 months. Now we've monitored 9 months. Now we've monitored a year, and the protections really are good. And based on what I'm seeing at a population level, I don't think it's that likely we would need a booster, certainly in the short term, unless we get a variant that emerges that it isn't protective against. And if we can get more people vaccinated, there's much less likelihood that that variant would emerge. And so there's also been some thought, there's been some additional work looking at people who are immunocompromised or people who are older and have other risk factors. I read a study just this month, a smaller study that was looking at people who were post-organ transplant, where they actually had given a third dose of the same vaccine to them. And, because some of those people had not mounted a good antibody response and had seen an antibody response for some portion of that. So there's extra work happening for the small number of people who are severely immunocompromised. And could there be a recommendation in the future that there's a booster for people who are living in long-term care or who are over a particular age or who have a particular condition? There might be. But I don't think anytime soon we'll be planning sort of high-level vaccinations. And again, the news is all good on this. And I think especially if somebody had COVID and recovered and had that vaccine, I think the chances of needing a booster shot are looking low, potentially ever. Okay. Let's see. Sarah Langneckart Upham from Facebook says, any update about vaccine for kids under 12? No official update. Trust me, we are watching this very closely. And it's taken a little longer to do these studies, partly because there are many fewer people getting COVID right now in the US. One of the reasons we were able to do studies quite quickly was that there are blinded studies where some people get the vaccine and some people get, an injection that is not the vaccine, and you follow them forward and you look for side effects, and that's part of how you understand safety, and then you look to see how protected they are from COVID. With kids, we had this additional layer of needing different dosing, and so there were a number of studies and kind of follow-on studies for these younger children to get the dosing right, to get the right level of antibody response that's going to be protective without, side effects, unacceptable side effects. And so it is still looking like the fall is likely. I do not think, in fact, I'm quite sure that there will not be a vaccine that is put forward to the FDA for consideration for younger kids before school starts. I think October is where, if I had to take a guess where this might be, I think it'll be somewhere in the September, October, maybe November. But I think maybe October is what I'm kind of hearing behind the scenes. But you can't rush it. You've got to make sure all these studies are done. There will not be a vaccine that gets authorized for younger children unless it is proven to be safe and effective using that same process. So that's where we are. And I know for families who have younger kids, it's a challenging time. The risk, again, for if you've got kids under 12 who can't yet be vaccinated, please make sure as much as possible all the adults around them are vaccinated. If all the adults around them are vaccinated, especially when COVID is in broad control here in Chicago, the risk really is very low. Okay. Leisha Smith from Facebook. World Health Association says vaccinated folks are not protected against Delta and need to wear their mask. Okay, so I think you're referring to the WHO, the World Health Organization. I talked about this a little bit on Tuesday, and let's be really clear about the recommendation. They did not say that vaccinated folks are not protected against Delta, but they did make a recommendation at the worldwide level around indoor masking broadly across the whole population. And a lot of that is because, and there was particular concern around the Delta variant because, again, and I talked about this on Tuesday, there are very, very large swaths of the world that have very little vaccine available still. You saw, how quickly the Delta variant is able to outcompete, like in that Scotland example that I showed. But they've not said that the Delta vaccine is not effective. I want to be really clear about that. It's just that there are a lot of people who are not protected at this point against vaccine, and not all of the vaccines have perhaps been working as well against Delta. There's been some concern about Sinovac. That's one of the ones from China. So I really keep the focus on the vaccines that are available here in the US. All the data, and the WHO agrees with this, is good, that the vaccine protection remains good against Delta. Just the concern is that there's a lot of people who are not yet vaccinated. And we've been lucky here. We have, if you think back to a few months ago, how desperate people were feeling to get a vaccine, that is still how a lot of the world is feeling about COVID. And in that setting, a recommendation to continue wearing it, I think, is good. We are following the CDC recommendation right now, which I think is appropriate for the US, but more importantly, we're looking at our local data, and where our local data shows that we are still in very good control, that we have not seen a major problem at this point, just like we didn't with P1, then we won't be changing that recommendation. I also want to make sure if we make a change in recommendation around things like masking, that's a big deal, and I want to make sure we do that at a point where the data is showing a major threat sort of now, and that we really need to change this. I don't want to turn recommendations on and off and on and off and on and off where places are really surging. And there are places in this world that are really surging. And even in LA, they're seeing some significant increase. They made that change in recommendation. We see a problem here. We'll do the same thing here. But right now, where we are is good. And again, just trying to get folks vaccinated would be the most important thing. Okay, Big Tree on Twitter, oh, good question, says, Mayor Lightfoot and Dr. Arwady, where is the investment in public mental health? We need healing for everyone. So I'm actually going to bring one of my colleagues from CDPH who is talking, to talk about actually a lot of the investments we have been making and continue to make in public mental health. Since Mayor Lightfoot came in, and this is a subject near and dear to my heart even before COVID, but then I think especially with COVID, right? Like everybody's been impacted by COVID. I think we're talking about mental health a lot more. And there's been a tripling of the city of Chicago's budget for mental health resources, and a huge increase in terms of the number of people who are being served, something like a 400% increase of Chicagoans who are accessing this. And there's much more that you'll be hearing over the next couple of months around really things I'm so excited about, where we are thinking about filling gaps for people with all different kinds of mental health needs, crisis needs, et cetera. So this actually has been a big investment, and it's one that I'm excited to be able to share some more about. And I do think as a city, it's an area that we want to keep our eye on and keep making sure that we're making investments in the places where it matters, just like we have been. Laura Jackson says, I'm going to read this, Laura, just because I think it's nice. Laura Jackson says, just came here to appreciate Dr. Arwady's necklace and her clarity. Thanks. That's sweet of you. And I will just say, like, I have really appreciated where people have emailed comments and compliments, especially to my team. I share them. My team's been at this for 18 months, and we are tired, and I have very much appreciated where folks have reached out about that, and I do share that with my team. We do hear from a lot of people who have concerns about vaccine and want to use public platforms to raise those, and certainly I get a lot of unhappy mail, but thank you for watching, and I like my necklace too, so appreciate that. Mark Britt from Twitter: what is my recommendation for singing in churches, as some churches may have unvaccinated children and adults alongside vaccinated? There can be aerosolization of droplets with singing. Should masks still be used inside churches? Okay. Good question. And actually, we're almost out of time, but I'm going to tell you a quick anecdote anyway, because just last night, I saw my mom. My mom is older and has significant underlying conditions, asthma, et cetera, and she's been very cautious during COVID. I took her to a restaurant last night. That was the first time she's been in a restaurant since COVID started, even though she got vaccinated as soon as she was able to. She sings in a church choir. It's like her favorite thing, but that has not been happening. She hasn't even been back to church at this point. But the church choir, they all had to report their vaccination status. 39 out of 39 of them are vaccinated, and this is a group that's been hit hard. I mean, there have been COVID deaths. It's like so many of the places where we gather, COVID doesn't feel so far away. But with 39 out of 39 people vaccinated, that is a safe environment for my mom, who I have concerns about, to be singing without masks, sort of in that setting. I think the congregational singing part is going to be a decision that's made a little bit at a church level. Again, if you've got a really high level of vaccination, I don't have a lot of concern about that. We have seen singing can be a risk factor. And so I think different churches, different groups will probably make some different decisions around that. And I think that's appropriate. Certainly, I know there are many churches that are first bringing back their choirs that can be distanced, and that you can more easily check vaccination status. But I know that this is something that people care a lot about in religious settings. And that's what I would have to say about that. And thanks for that question. Okay, we are just about at time. Let me see if I can hit a couple really quickly. Abena Sharon from Facebook is wondering, why do we need an appointment for the second vaccine? Why can't you walk in for the second shot? You can walk in for the second shot. But if you make an appointment, you can be sure it's the right vaccine, because sometimes not every pharmacy has all the vaccines at all times, or you can make sure that you won't have to wait, it will be available. So we encourage people to make the appointment, but we do take walk-ins for second doses just like we do for first doses. All right, and there's a whole bunch of different questions we didn't get to, so we will definitely come back and get some more of those next time that we're on. Kim McDonald on Facebook: if your children get the vaccine this summer, will they be able to get the flu shot in the fall? Absolutely, 100%. There is no link between these. In fact, they could get the COVID vaccine and the flu shot at the same time without a concern. And as we do flu campaigns, we will make sure COVID vaccine is available for people who maybe hadn't gotten that. But yes, you can get all of your childhood vaccines, all of your flu vaccines without concern at this point related to the timing of the COVID vaccine. Thank you all so much. Really good questions. We will be back next Tuesday to answer more of them. And where you've put them in and we haven't gotten to them, sometimes I can pull, science questions, things we're reading to help answer that. So do not fear if we didn't get to your question. Thank you so much for tuning in. And please continue to talk about vaccination, ask the questions that you have. Getting Chicago highly vaccinated is how this becomes something that, as the first questioner asked, is COVID over? Vaccination is the best path toward it being as over as it can be. Thanks so much. We'll see you next Tuesday, same time, same place.